Part 2 of the doctor's office. It's getting ready to be a long video and I can't do nothing about that. Story time. So I was at the doctor earlier today. Now the reason I was at the doctor is because, ladies, I went and got a mani and pedi. And the girl cut a part of my foot, like by the toe, which ended up causing it to become infected. Right? It was like some stuff, but I had a funeral this past weekend that I had to attend out of town. I just got back in town. So then now I go to the doctor thinking I'm just going to get an antibiotic, probably for the infection. So she looks at my toe. That's where I was at, right? The doctor's this morning. She tells me that she doesn't want to give me a topical medication, that she wants to give me an oral medication. And the medication that she's going to give me is not just for the infection, but there's actually like fungus on the toe. Like it's literally purple. My toe is purple and black. I'm gonna have to give you an antifungal oral medication, and I want you to take that for 6 weeks. 6 weeks. She says, yes, I need you to take it for 6 weeks. Well, I'm gonna write it for 12 weeks. But at the end of 6 weeks, I'm going to give you an order, which she gave me. I'm going to give you an order for you to go have some blood work done, because this medication tends to cause people to have a liver infection or damage to their liver. So if after 6 weeks you go get your blood work done, we find out that there's damage to your liver, I'm going to take you off that and put you on this other medication. Now, the reason why I'm not starting, she tells me, with the other medication is because one of the main complaints from patients on that medication is migraine headaches. So I tell her I don't have time in my schedule for migraine headaches, nor am I going to take any drug for a toe infection for 6 to 12 weeks. I'm not doing that. I'm not doing any of that. It don't make sense to me. Yeah, penicillin, Bactrim. I mean, when did we start taking pills for 6 to 12 weeks for anything? I happen to have a healthy liver. I don't want to take any medication that's going to cause me to have, and the liver damage from the people taking this medication, is it reversible? She was like, well, it's not really reversible, but that's why I'm doing the blood work, because I need to run blood on you to see if it damaged you at all or it didn't damage you. See, that also doesn't work for me. I shouldn't have to come in here to get an antibiotic for a toe infection and then 6 weeks from now have to get blood work because the medication can cause me bad side effects. No, ma'am, that doesn't work for me at all. So is there another remedy, some holistic or like a home, like what can I do? Because that's not gonna work for me. She says, do you have any vinegar at your house? Yeah, I got apple cider vinegar. She said, apple cider vinegar or white vinegar? She said, yeah, just pour it in a bowl, or, you know, if you have a pool, you know, foot spa at your house, pour that in there and soak your foot in it for 3 to 4 days and it should probably go away. What? Wait a minute. Hold on. I said, wait a minute. Why didn't we lead with that? Why don't we lead with vinegar? We'll take out that fungus and kill the infection in your foot. Why wouldn't we start there? And she says, well, I'm a medical doctor and holistic approaches are not scientifically backed. So I'm going to always lead with medication. However, since you requested another alternative, I'm giving you another alternative. I said, there's not going to give me a headache or damage my liver, because me soaking my feet in vinegar is not going to destroy my liver, right? She said, of course not. The medical industry, I don't know. So not only did I have to sit there, I was on time for my appointment. As I said, I was early, because they have you come 15 minutes early so that you can fill out all the paperwork. But if you're not on time, like their big sign says, they're going to charge you a $50 late fee that's automatically billed to your credit card on file, and it's an automatic reschedule. But then I can come there and be on time, be early, but sit in the room for 54 minutes before you can come up in there as if my time is not valuable or that my liver is not valuable. My liver is valuable. Not having headaches is a way of life for me. I don't want that. I just don't get it. These doctors, these 2023 doctors cut different. That's all they cut real different.